This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, October 14th, and I'm Zach Caruso. Our lead story this week is in JAMA Psychiatry and is titled Measures of General Intelligence and Risk for Alcohol Use Disorder. This male Swedish cohort study that included 573,000 participants assessed if there is an association between IQ and risk for alcohol use disorder, and if so, what is the nature of the association. It found that IQ at 18 years old was associated with subsequent alcohol use disorder risk. Mendelian randomization analyses suggest a causal association, albeit with context-dependent differences. Genetic liability for cognitive performance also predicted alcohol use disorder in a US-based sample. Results suggest that there was a clear impact of genetic liability for cognitive performance on alcohol disorder risk, but the association varies based on the sociocultural context. Next is an article in JAMA Network Open titled Naturalistic Tobacco Retail Exposure and Smoking Outcomes in Adults Who Smoke Cigarettes Daily. This cohort study of 273 individuals who smoke cigarettes daily explored if exposure to retail marketing in people's daily environments is associated with critical health risk behaviors such as smoking. Individuals reported significantly greater cravings and smoked more cigarettes on days when their smartphone logged tobacco retail exposure was higher than usual. These findings suggest that tobacco retail exposure is associated with smoking dynamically across time, with important implications for public health. Our next article is in BMC Public Health and is titled Global Burden, Socioeconomic Disparities, and Spatiotemporal Dynamics of Opioid Use Disorder Mortality and Disability, a comprehensive analysis from the Global Burden of Disease Study 2017 to 2021. This study analyzed data from the Global Burden of Diseases, Injuries, and Risk Factors study from 2017 to 2021, including age-standardized mortality rates and disability-adjusted life years, or DALYs, in 204 countries and territories. The study found that global OUD mortality increased by 12.4% from 2017 to 2021, with the Americas as the epicenter. Areas with higher sociodemographic index, or SDI, had 17.8-fold higher mortality rates and 13.9-fold greater DALY rates than low SDI regions. The study also highlights that disability was mitigated by evidence-based harm reduction policies in high SDI countries, whereas low SDI regions saw increasing DALYs. Next is an article in Drug and Alcohol Dependence and is titled Treatment and Recovery from Opioid Use Disorder, the Role of Pain Severity in Individuals with Moderate to Severe Pain. Researchers evaluated the cost of implementing 15 evidence-based practices, including overdose education and naloxone distribution, or OEND, and increased MOUD, in rural and urban settings as part of the Healing Community Study. The average cost of intervention was $147,000 for OEND and $345,000 for MOUD. While overall cost of interventions was greater in urban areas, the per capita was greater for rural communities. Authors note that understanding these costs and differences can help inform selection of interventions for communities based on need and resources. Our next article is in Addiction Science and Clinical Practice and is titled Cost of Implementing Evidence-Based Practices to Reduce Opioid Overdose Fatalities in New York State Communities. Chronic pain is a common comorbidity among persons with opioid use disorders, and researchers conducted a secondary analysis of 3 trials assessing association between pain and treatment outcomes with buprenorphine. The researchers found that while pain decreased during treatment, persons with more severe pain had lower abstinence rates, lower quality of life, more depression, opioid withdrawal, and cravings. They did find that pain was not associated with differences in treatment retention. Authors suggest evaluation of pain at baseline and during treatment could better inform patient experience and help to optimize treatment. Next is a study in substance abuse treatment, prevention, and policy and is titled Barriers to Opioid Replacement Therapy in Pregnant Women with Opioid Use Disorder, a Systematic Review. This is a systematic review of 23 articles focused on MOUD in pregnancy with a focus on barriers to treatment. Patient-related barriers identified in the review included fear of stigma and judgment, concerns for the risk to the fetus and neonatal opioid withdrawal syndrome, fear of child protective service involvement, the belief that MOUD replaces one drug with another, family pressure and opinions, and intimate partner violence, as well as logistical barriers such as transportation or childcare needs. Provider-related barriers included hesitancy and discomfort with treating OUD in pregnant individuals, biases and negative attitudes towards patients with OUD, time constraints, and knowledge deficits. Health system barriers included geographic access to care, complex healthcare systems, limited clinic hours, insurance coverage gaps, and financial barriers. Our next article is in the Journal of Addiction Medicine and is titled Naltrexone in the Treatment of Ketamine Use Disorders, a Case Report and Literature Review. This case report describes a 25-year-old woman with ketamine use disorder, or KUD, that improved after treatment with oral naltrexone. She had used 1 to 3 joints of cannabis daily since age 15, and she had been taking sertraline 200 milligrams daily for major depression since June 2019. In November 2020, she began using ketamine, and by February 2022, she was using 1 to 3 grams daily intranasally. She lost interest in socializing and other activities and lost 19 kilograms of weight over 24 months. Attempts to quit resulted in intense cravings, tremors, sweating, and abdominal cramps. She also had symptoms of ketamine neuropathy. In January 2023, she sought treatment and received psychoeducational group therapy and naltrexone 50 milligrams orally daily. Over 2 months, her cravings were minimal, weight, mood, and abdominal cramps improved, and she had abstained from ketamine. Authors note other case reports of naltrexone treatment of KUD and call for further research. Our final article is in BMC Medical Education and is titled An Evaluation of an Inpatient Opioid Use Disorder Consult Service Elective for Medical Trainees. This paper describes the experience of 24 residents and 10 medical students on a 2-week elective with an inpatient OUD consultation service that sees 45 to 60 consults monthly. The rotation reduced the proportion who felt they didn't have adequate training in OUD from 96% to 20%. After the rotation, over 90% felt prepared to diagnose OUD and treat OUD and opioid withdrawal with medications. Following the elective, 96% felt as comfortable talking with a patient with an SUD as one without an SUD, although about half would feel uncomfortable revealing to a colleague that they had an SUD. Almost all disagreed with the statement, patients with SUD will never recover enough to have a good quality of life. Authors conclude that those completing this elective were confident in managing OUD and had little stigma towards these patients. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.